Right now, let's bring in a couple of congressmen from both sides of the aisle to weigh in on this. Democratic Congressman Joe Sestak of Pennsylvania, along with Republican Congressman Darrell Issa of California. Let's start with you, Congressman Sestak. The president has given many speeches on this. Is there anything you expect to hear new or different from the president tonight?
What I think I'm going to hear and what I really want to hear is something that I was very aware of when I served in Navy ships for 30 years. Besides disease and fire, rumor, which can be so destructive, is what we most were concerned about. He has to lay out the facts and set aside the myths and the misleading information that has been perpetrated out there. Second, he has to demonstrate the leadership that it isn't just what people want, as there was stated a little previously, it's actually what they need. And that's because the Department of Justice has a criteria, and it says that 92% of our health insurance markets are non-competitive for pricing. We have near cartels across America. And so we need to do two things. Begin to have a public option that is funded only by those who choose to join it. It's not funded by the government. And begin to get fair competition. And second, stop the insurance companies from rationing care and deciding who is denied it. And when someone goes in for health care, then they say, that's when I'm going to deny it to you. And he has to make that very clear.
But Congressman Issa, at what cost? If you look at budget deficit projections from the CBO, we are talking more than $200 billion more over a 10-year stretch in federal deficits now because of this proposal, just this one proposal, not other stimulus, not bailouts, all of that. The cost seems to be the problem for the American people.
Well, absolutely. And if the president comes, as Joe's suggesting, and says, liars, liars, your pants are on fire to the Republicans, he's not going to get anywhere. The American people understand that rising cost of health care is, in fact, not the insurance companies doing it, but in fact, it's symptomatic. And to vilify insurance companies and to pretend that the government can do a better job, the government has proven that paying only 70 cents on the dollar of what a doctor needs to do a medical procedure, which is what Medicare does, and then not controlling excess procedures isn't the answer either. So I'm hoping that the president thinks twice about simply vilifying insurance companies or Republicans and comes and says, now I want to begin the process of a bipartisan bill that reduces cost. If you reduce cost, then this program shouldn't cost the American taxpayers a penny. It should actually save the American people money.
Congressman Sestak, it's Greg Jarrett. You said in your recent debate with Congressman Toomey that this bill will not, and I watched it, and it was quite civil and very good, but you made the statement, and you got a bunch of jeers on this, when you said this bill will not produce a single additional penny to the deficit. Now, the Congressional Budget Office, which is nonpartisan, says that is utter nonsense. They claim that it is going to increase the budget deficit a net $239 billion. Are you telling me the CBO, nonpartisan, is wrong and you're right?
Pat, as you listen, Gary, to me debate Pat Toomey, a good person, we differ. I said it does not add a cent, contrary to what was stated here, to the budget deficit in the next 10 years, with the exception of the $239 billion that is a 21% cost in Medicare reimbursement to physicians that would have occurred even without any health care reform. That $239 billion is a 21% cut, just like 11% happened last year, and we are going to pay that. I believe we should have done it under a pay-as-you-go. I think the Democrats were wrong not to, but that was absent outside of this health care reform.
Let me ask you both this. Let me start with Congressman Issa. I want to pick up on what Greg just said, because the CBO's estimates are without proposed tax increases in place. I mean, this is not a self-financed. That's what the CBO is saying. This is not a self-financed reform plan. And then, look, I'm sorry, but $1 trillion? I'm a numbers gal, guys. That is extra $300 billion in interest payments that we're going to have to pay out, half of that money going to the Chinese, if a $1 trillion price tag goes through.
No, you're absolutely right. And the American people are seeing through a projection that it's only going to cost so much. No government program only costs what it was projected to cost. So the deficit that's projected is not the deficit we'll get. This will, in fact, get more expensive. and ultimately lead either to bigger deficits or, even if Joe's right, it's going to lead to higher taxes. And taxes right now, if they were significantly higher, still wouldn't eliminate the deficit we built up through other spending. You pile $1 trillion or $2 trillion or $3 trillion of additional health care expenses, and in fact, there's no place to get it. The American people are going to be tapped out long before we get to that figure.
But if I could, the CBO study actually said this is going to cost the House bill $1.02 trillion, and it did say $550 billion was found in Medicare efficiencies validated, and another $500 million was found in tax revenues. It is budget neutral. The only part that isn't is an additional $236 billion that is just a standard every year, the Medicare cuts, physicians thing. So this does not add a cent in the next 10 years, except for that $239 billion that would have...
Real quick, gentlemen. Real quick, I got to ask you this real quick. If there's, Congressman Sestak first, if there is tort reform in this president's plan, will you vote yes? Can you both answer that question?
Nope.
CBO both said tort reform only costs half of 1%. We're addressing 99.5% of the cost. Well, and I don't believe we need tort reform. If every person have their day in court.
Congressman Issa?
You know what's amazing is you can see tort reform is dead on arrival, when in fact defensive medicine has built up a third of all health care costs comes from procedures that wouldn't be done except to protect the backside of hospitals and doctors. So tort reform is crucial, but it's not essential to be part of a comprehensive program. Just the opposite. There are incremental 4, 5, 6 things that could be done that would dramatically reduce the cost to companies and individuals that, in fact, would negate the need for most of what the president is saying is a crisis.
Interesting angles from both of you. All right, Congressman, thank you. Congressman Sestak, Congressman Issa.